Now, let's talk about what can happen if things are a little abnormal. For example, hypertension. If you remember, we said at the beginning, hypertension was high blood pressure. Now, that doesn't really deal much with the heart, and it more so deals with the vessels, specifically the arteries. Hypertension is referring to when the arteries have a high pressure inside of them. Like this aorta right here. If it starts experiencing a high pressure from the inside of that blood pushing from the inside against the walls, that's called high blood pressure. Now, how do we measure high blood pressure? Usually you've seen it done here on the brachial artery, but ideally we would measure it on the aorta. We can't do that, so we take it here on the brachial artery, sometimes on the wrist. That can be due to genetics. It can be due to poor lifestyle. What ends up happening is these arteries, they lose their elasticity. They're not able to stretch as well. And so the pressure inside of them increases. And that can lead to things like coronary artery disease. Because the pressure is so high, the blood moves slowly and there's more chances for plaques to develop. The next one is a heart murmur. You've probably heard of that before, but what is a heart murmur? Well, remember these valves we talked about? We learned about four valves, right? The tricuspid and bicuspid valves, as well as the pulmonary semilunar and aortic semilunar valve. Well, remember how those were one-way valves? They're not perfect. And sometimes if blood flows abnormally through them, or even flows backward through them, called regurgitation, that causes you to hear a sound when you're listening with your stethoscope, and that's called a heart murmur. Usually, heart murmurs are pretty innocent, and they don't really mean heart disease, but they are something to monitor and keep track of. The third one here is a myocardial infarction. And if you remember when we said at the beginning, myocardial infarction is the fancy term for heart attack. What is a heart attack? Well, as you could imagine, we're sending blood to the body to deliver that oxygen, right? Because we need to create energy. We need ATP. Well, guess what needs the most ATP? The heart itself. So there's a vascular system of the heart where it delivers blood to itself. And it's delivering that blood to this myocardium here. All of these muscle cells need freshly oxygenated blood. And if it doesn't get freshly oxygenated blood, then it starts to not produce ATP. And if it doesn't have that energy, that tissue can die. And that is known as a myocardial infarction, when the myocardium of the heart dies due to lack of oxygen. That is most commonly occurring on this left side here because that thick layer of myocardium requires the most oxygen. The last thing I want to talk about is congestive heart failure. What do we mean by congestive heart failure? Well, think about it in terms of traffic on the freeway. We talk about how the freeway is congested, lots of traffic moving slowly. Congestive heart failure can be divided into right-sided congestive heart failure and left-sided congestive heart failure. If blood is moving too slowly due to things like the heart muscle being weaker or less efficient and it's not pumping as much blood per beat, that lack of efficiency causes blood to back up. If it's not moving through these chambers as quickly, it starts to back up. So if it's getting stuck in these areas, it'll start to back up, causing congestion in these vena cavas and then further down the line. And if you don't know, these vena cavas lead to the rest of the body. And if there's congestion in these vessels, there'll be congestion all above and below those vessels. And that's why right-sided congestive heart failure leads to swelling in the arms and especially in the ankles, because that congestion causes the blood to leak out of capillaries into the tissues, right? So we get this congestion and buildup of fluid in the body. So swelling in your tissues can be a sign of congestive heart failure. What if the congestive heart failure is on the left side of the heart? Well, if it's congested here and it's congested here, then it will get congested in these pulmonary veins. And if we follow those, where do those pulmonary veins lead to? They lead to the lungs. And you start getting congestion in your lungs. And that can lead to things like cough and shortness of breath, which is why sometimes heart disease leads to pulmonary symptoms. And it can lead to cough and shortness of breath, especially during activity. So it's really important that you monitor these symptoms because several systems here, respiratory and cardiovascular, are very closely related. I really hope that the flow of blood through the heart helps you understand how important normal anatomy is and how when those things go wrong, we can get some kind of pathology that can, in this case, be life-threatening. Thanks for listening. See you on the next one.